Good afternoon, everyone. I think people are making their way in, getting in connected from our waiting room. I'd like to welcome you to CERAH's Winter Lunch and Learn series. I'm Stephanie Hendrickson, and on behalf of CERAH, I'm pleased to open our session today and introduce our speaker, who is Chantal Chartrand. And she will be discussing how to better serve Francophones and their families in their most vulnerable times in the context of palliative care. So we're really looking forward to the presentation today. I do have just a couple things to mention before turning it over to Chantal. Our session, as always, is being recorded today, and we'll add the recording to our CERAH Education archives after the session. And we'll be posting those on our new website, which is cerah.lakeheadu.ca. And you can find all of our archives under our knowledge translation section on the website. And if anyone would like a copy of Chantal's slides, she's happy to share those, and you can send me an email and I'll follow up with you around that. Chantal today would like to have questions saved for the end of the presentation. If you're worried you might forget your question, you can feel free to pop it into the chat box, but just be aware that we'll be addressing those after the presentation. And at the end, if people are willing to unmute themselves and come on video and ask questions and make some comments, it would be great to see you all. But during the presentation, if you can stay on mute, and it's up to you if you want your video on or off, just so we can reduce the distractions. So it's my pleasure to introduce Chantal today, and Chantal Chartrand is the Planning and Community Engagement Officer for the Northwest region with Réseau. And I'm going to let her say the rest, which tells you something about my French speaking abilities.
Thank you, Stephanie. I'm with le...
You mind just pronouncing the...
Le Réseau du mieux-être francophone du Nord de l'Ontario.
Thank you. And Chantal has been actively involved in the planning of French language health services for the past 10 years. And Chantal brings with her a wealth of information about patients' experiences and needs based on her interactions and engagements with Francophones living in communities here in Northwestern Ontario. So thank you once again, Chantal, and I'm going to turn it over to you.
Thank you, Stephanie. Thank you again for inviting us today. And I also wanted to share with you that I have been a member of the Regional Palliative Care Program Advisory Committee for the last few years, and that we recently engaged the Francophone community in June of last year. And one of the activities coming from that engagement was to create more opportunities for Francophone sessions or awareness sessions like today, and to work with CERAH. So I'm very happy to be able to do that today. And I also was able to do a similar presentation to the advisory committee. So again, another good opportunity to share the needs of Francophone of our Francophone population. So I will just begin with our learning objectives today. Which you're aware of, they were on the poster. So overall, it's to increase your awareness of the needs of the Francophone population so that you leave with a better understanding of what active offer of French language services is, to be able to identify what best practices are of active offer, to understand better the role of the Réseau and what we could do to offer any resources to you, and specifically other French language resources that are available, and especially those of L'Accueil Francophone de Thunder Bay, which offer French language interpretation services. Next slide. And quickly, the overview will be to talk about the Réseau. We have two different patient experience videos, and I hope to for sure, I will show the first one, and the second one, we will see how much time we have at the end. And again, quickly go through the Francophone population, the French Language Services Act, and the differences between identified and designated providers, communities, but just shortly, again, benefits of active offer, roles and responsibilities of active offer of French language services, culturally adapted care, resources, and l'accueil francophone. Next slide. So to begin with, about the Réseau, we have a dual mandate. We are, as far as our federal mandate, we are one of 16 members of Société Santé en Français that promotes the development of French language health services in Francophone minority communities in collaboration with 5 groups of partners. And this is funded through Health Canada. We also have a provincial mandate. So with that mandate, we are one of 6 French language health planning entities mandated by Ontario Ministry of Health, who works with healthcare system planners. We engage the Francophone community, and we support healthcare providers in the planning of their French language services. Next slide. So our major work areas are the planning of French language health services. So we really help providers develop their capacity. We act as a Francophone lens on several tables and committees. We try to really make a difference in those areas. We also engage the Francophone community, similar to the event I shared earlier, where we had a specific engagement with Palliative Care. We assist either providers also with engaging the community when they need to do so, and we do our own engagement. We also did a specific Francophone engagement for COVID-19 and different types of events like that. And we support healthcare health service providers with any needs that they need and sharing resources. And most recently, we work with supporting Ontario health teams in the development or implementation, depending on where they're at. So before I continue, I'd like to share with you a patient experience. It's a very good video that gives a good example of a situation of a Francophone in palliative care. Mr. Ronald Bisson in this video will discuss the end of life of his brother, a bilingual man who lost the ability to understand and speak English when he was at end of life. And the video is in French, but the subtitles are in English. So I'll let Stephanie go ahead and share that.
C'est littéralement une question de vie ou de mort. Alors, ma nièce m'a appelé, c'était le 10 novembre, et puis elle m'a dit que son père, donc mon frère, était rendu inconscient, qu'il était dans le coma, et que c'était vraiment vers la fin. J'ai décidé de me rendre dans la ville où était mon frère, et puis lorsque je suis arrivé, ma nièce, elle m'a dit, ça fait 24 heures qu'il est complètement inconscient, il parle à personne. Alors, je suis rentré dans la pièce, évidemment, tu comprends, son épouse est là, les enfants, on est une grosse famille, on est tous prêts. Et puis, moi, j'ai parlé français. Mon frère, son épouse est anglophone, et ses enfants étaient tous anglophones aussi. Alors, je suis rentré dans la pièce et je lui ai dit « Bonjour Gérard, je suis venu te voir ». Et je parlais toujours en français. Et à la grande surprise de tout le monde, il a ouvert les yeux, puis il m'a reconnu. Et il m'a fait un beau sourire béatifique. Alors, j'ai commencé à lui parler. Il m'a dit, je vais mourir. J'ai dit, est-ce que tu es confortable avec ça? Puis il m'a dit, oui, je suis confortable avec ça. Je vais aller voir et je vais rejoindre notre autre frère, notre sœur et notre mère qui venaient de mourir récemment. Alors, je continuais à lui parler en français. Puis à un moment donné, je lui ai dit, en passant, ton épouse est ici. Elle voudrait te dire au revoir. Et quand elle a commencé à lui parler en anglais, j'ai vu qu'il ne comprenait plus l'anglais. Et il ne pouvait plus parler l'anglais à son épouse. Alors, j'ai fait l'interprétation pour son épouse, pour les enfants. Mon frère, qui était parfaitement bilingue, ne pouvait plus comprendre ni parler l'anglais dans ces 48 heures. Alors, ce qui est arrivé, c'est qu'il n'était pas inconscient lorsque ma nièce m'a appelé. C'est qu'il ne pouvait plus comprendre ce que les gens lui disaient. À un moment donné, elle me dit, Papa est rendu qui fait des psychoses. Il ne me parle qu'en français. Puis, j'avais pas compris encore, parce que je l'avais pas vu, je n'étais pas encore allé, j'avais pas compris que c'était pas une psychose. Il essayait de communiquer. Alors, elle était abasourdie. Ben, papa, il me parle juste français, il est rendu psychosé. C'est ce qu'elle disait aux infirmières, papa est psychosé. Et puis là, les infirmières arrivent, puis ils posaient des questions en anglais. Il répondait encore juste en français. Il y a eu bien des médicaments pour le calmer, tu comprends? Et c'est juste après coup que j'ai tout fait les liens pour se dire, il essayait de communiquer. Ça, c'était à peu près 2 jours avant de mourir, donc je dirais dans 12 heures avant qu'il devienne inconscient. D'ailleurs, son épouse m'a dit après coup, parce qu'on voit toujours en arrière les choses plus clairement, elle m'a dit, dans la dernière semaine, il était très agité avec sa famille, au point où ils ont dû l'attacher à un moment donné, mais il était calme seulement quand mon neveu venait le voir. Et un de mes neveux lui parlait en français aussi, et c'est le seul temps qu'il était calme. Alors, son épouse, elle me disait, c'est drôle, le neveu et toi, vous avez un effet calmant sur lui. Mais c'était juste après, quand j'ai réfléchi, que j'ai compris que c'était pas nous qui avions un effet calmant, c'est que tout à coup, il se faisait comprendre. Sur le plan linguistique, je dois te dire, j'étais très heureux d'être là, parce que si je n'étais pas venu, mon frère serait mort, je pense, en grande détresse, parce qu'il ne pouvait pas se faire comprendre. Je dois te dire que lorsque son épouse et les enfants ont pu lui dire un dernier au revoir, eux, dans leur cœur, ça faisait 24 heures qu'ils étaient morts, qu'ils ne pouvaient plus le rejoindre. Quand ils ont pu lui dire un dernier au revoir, ça a été un moment précieux comme on ne peut juste pas imaginer pour eux. Alors, sur le plan linguistique, j'aurais aimé qu'ils puissent avoir sur le plancher des infirmières ou quelqu'un qui aurait pu le comprendre et lui parler aussi dans ces derniers moments, juste sur le plan médical. Ça, c'est un regret que j'ai, mais j'étais content d'être là pour le faire.
Okay. Did it cut off a little bit early, Stephanie?
Oh, I'm sorry, that wasn't the end?
Yeah, no, I think it's fine. It might have just been like a few seconds, but
Okay.
That's okay. So thank you again for playing that, and I hope you you appreciated the patient's story. It's a really powerful one, and it's very true, but very sad at the same time. So I'm glad that he was there for his brother. We'll begin today with just a quick overview of the Francophone population specific to the Northwest. As you can see, the overall population for the Northwestern Ontario region is 3.1%, which is fairly small. However, the District of Thunder Bay at 12.3% is the biggest population. I will go over, if you see in the next slide, just the impact of the population and how it affects services. So with regards to French language services, it is all managed and governed by the French Language Services Act, which guarantees an individual's right to receive services in French from the Government of Ontario ministries and agencies in 26 designated areas. And you'll see on the next slide that in Northwestern Ontario, we have 2 designated areas. So the District of Thunder Bay, which includes Geraldton, Long Lac, Marathon, Manitouage, Beardmore, Nakina, and Terrace Bay, and the District of Kenora with the Township of Ignace. So these communities are in designated areas. So providers that serve Francophones or have patients and clients that come from the region have been identified to be able to offer French language services. You'll see in the next slide that in the Northwest region, we have a total of, this is just to give you an idea, we have 51 health service providers that are funded by Ontario Health. And in terms of the number of them identified to offer French language services. We have 15 in the district of Thunder Bay, in the city of Thunder Bay, 6 in the district, 4 in Kenora, and 26 total that are non-identified, but they still need to try to, they share what employees they have in place. They will, it is up to everyone to try to serve the Francophone populations, but that just gives you an idea of who is identified. And if you look at the far end, we have 2 designated agencies that are not funded through Ontario Health, but they are L'Accueil Francophone, which Angèle is with us today, and CERAH, which is a center for women victims of abuse. Next slide, please. So we will begin now looking at active offer of French language health services. And active offer has become a term used in the last few years that basically means to take the onus off the patient to ask for their French language services. We really want to try to create a higher awareness with providers that they should be actively offering their services, just to make it easier for the patient or the client. So the action of proactively offering quality services, active offer is the action of proactively offering quality services which are available at all times, clearly communicated, visible, easily accessible, and equivalent to the quality of services offered in French. We understand that in Northwestern Ontario, it's not always possible to have all of this available. However, we ask that everyone start somewhere and work towards having these things in place. Next slide, please. It's also important to point out that language is truly essential to the improvement of health outcomes and the self-management of one's own health. It's also related to the ability to care, help, advise, and guide, educate, and provide quality health care. Next slide, please. And I'd also want to point out again that vulnerable groups are, it's important to be aware who the vulnerable groups are. And some groups are more vulnerable if they do not receive health services in their language, such as children, seniors, newcomers, individuals in crisis, and people at end of life. And this is where it's important to understand the reality of Francophones. Although some Francophones may be bilingual, most people can get by, in everyday life, going to the restaurant, getting what they need in their communities. However, in crisis situations and when ill, and as they get older, they often revert to using their mother tongue. They truly need services in their mother tongue when discussing their health. Next slide, please. And this is where I'd like to look at the impacts of language barriers. Often we've heard many stories about, the delay or lack of follow-up treatments due to people not understanding what was shared, increased number of diagnostic errors and treatments, increased occurrence of critical incidents due to professional errors, a misunderstanding of diagnosis or treatment, increased number of unnecessary or inappropriate hospitalizations, inadequate management of chronic illnesses. We've often heard either from a patient or a provider, a patient might just nod yes or give the illusion that they understood, but in fact they didn't. So it is truly, it can be very dangerous. Next slide, please. So this is where we will look at the benefits of active offer of French language health services. The positive impacts of French language health services for Francophone patients are that they will have the ability to express their needs and explain their symptoms. They will have a better understanding of the treatment plan and adherence to it. They might feel more comfortable asking questions or asking someone to repeat, whereas if it wasn't in their language, they, again, probably would just shake their head yes and leave with a lot of unanswered questions. Their overall improvement will be a lot more positive. Improvement of their patient experience will be more positive, and they will have a better health management. And the positive impacts for, in terms of what the healthcare professionals will feel, they will have improved accuracy of the health assessment. They will definitely be able to have a better interpersonal interaction during the treatment, effective communication with the patient and client, and improvement of experience for the professionals in general. And we've often had professionals share with us that the minute I said bonjour, or even if my French wasn't all that best, the greatest, the minute they addressed the patient or their client in French, their physical, they had a physical signs of relaxing. The shoulders drop, they can take a deep breath, and they know that they're going to be able to share what they need to share with their health professional. Next slide, please. This is just a quick little poster of best practices of direct client services. So what you want to try to do is have bilingual professionals, try to recruit bilingual volunteers, make sure that you have a bilingual reception and services, identification of language, of service, bilingual voicemail, have communications plan and strategy. If you do have third-party contracts, to think of how the French language services will be planned out with them. And when you do have a patient satisfaction questionnaire, to not be afraid to include a question on French language services or have one in French, and be aware of what interpretation services are available, such as l'accueil francophone de Thunder Bay, when you don't have the bilingual professionals or bilingual volunteers. Next slide, please. In terms of roles and responsibilities in the active offer French language health services, we'll go through a few more. This is a kind of an overarching slide about the different levels when it comes to active offer. At the system level, we look at government authorities make sure that organizations are accountable for active offer. At the organizational level, it's the health service providers that take leadership by implementing French language service policies, procedures, and a culture that promotes active offer. And as we just discussed, at the professional level, healthcare professionals practice active offer and understand the needs of Francophone clients. And in terms of the individual level, Francophones identify themselves, actively use French language health services, and participate in the planning process. But we do know that in terms of palliative care, this is not where we would put the emphasis on the individual level, because they are very vulnerable. So it would be the other three. Next slide, please. Again, another quick checklist. And also today, there are several slides, but I wanted to make sure you had everything in one spot so that you can refer back to it. But as a health service provider, your role in terms of the promotion of active offer is to include the Francophone community at the governance level. That's something that we've often helped our providers with. If you need help recruiting a Francophone member, we are happy to do that. To develop a policy on active offer and French language services. Integrate French language services in your strategic planning. And we've also helped facilitate including the Francophone community when you do want to include them in your strategic planning. We've had specific Francophone engagement sessions for providers and for our partners. Engage the Francophone community. Again, we're happy to assist you with that. And plan, coordinate, and assess French language services. Next slide, please. Recruit and retain bilingual staff, create an internal culture that promotes active offer, increase awareness of the importance of French language health services with its employees, provide training to employees on the legal requirements regarding French language services, and empower the employees in the implementation of active offer. Culturally adapted care. Culturally adapted care for Francophone is, it's very unique. It means that French language and culture are reflected and incorporated at all levels of care across all programs and services. A healthcare professional who is equipped to deliver patient-centered care is respectful of the patient's values and will be in a better position to ensure the safety of patients and the quality of service. We have seen, in terms of benefits of culturally adapted care, signs that there are lower levels of depression, a decrease in feeling isolated and lonely, a feeling of safety in a more familiar environment, a decrease in stress levels, an increase in morale and general well-being and self-esteem, and an increase in satisfaction level of residents and their families. And we know, I know in the title of the presentation, we talk about the Francophone and their families. And especially in palliative care, when you've got a loved one who is at end of life, if they receive good care or proper care and they feel all of these benefits, the families will automatically feel them as well. Next slide, please. So in terms of implementing culturally adapted care, I think it's important to have that understanding of the reality of Francophones and the importance of language in vulnerable situations, similar to what we discussed earlier. Even though someone is bilingual, what happens and at end of life or when they're in pain or in crisis. Offering professional development to increase staff and volunteer awareness. I will share specific professional development that we can offer that are free of charge in the next few slides. We also encourage developing key partnerships with the Francophone community to develop and offer activities in French. Offering cultural activities such as having music, movies, TV, books, and magazines available and accessible in French. Sharing a calendar of activities that are being offered in your community in French, such as cooking or arts and craft, and offering the opportunity to receive spiritual and religious support in French. I know recently I spoke to a colleague, and she mentioned that in terms of palliative care is where a lot of Francophones truly need and benefit from speaking in French and having the spiritual and the religious support, and to not have that is really difficult for them. Next slide, please. So in terms of French language health services and resources, I'll just go through a few and then I'll go through a few more at the end with Angèle from l'Accueil Francophone. We do offer an interactive online training on active offer of French language health services. For years, there was, well, you're probably very familiar with the Indigenous cultural sensitivity training. That's approximately 14 hours. And for years, we thought it would be great to have something available or similar for professionals and volunteers to take, to be more aware of the Francophone population and its needs around in health services. So we were able to develop this online training. It is free of charge and available to take in French or English. The next slide has a bit of has a more detailed description of each module. And we also do awareness sessions on French language health services. I am more than happy to go into your own organizations and do a specific presentation on linguistic barriers or active offer. And I've done it at the board level. I've done it with management or leadership teams and even the frontline level. We also offer a training called Interpretation in You, and that was also developed by l'Accueil Francophone, but we have an agreement where we continue to offer the training. And the training was created to help support healthcare providers that have French-speaking staff, but don't have internal resources on supporting them in their role when they do act as interpreters. And we know that it can be a little bit of a tricky situation, or there could be risks involved if the French-speaking staff doesn't have the support they need. So this training is about 2.5 hours long, again, free of charge. And at the end of the training, the French-speaking staff in your organization would have a better understanding of, the differences between the different types of interpretation and how to better support the client or patient that they're interpreting for. And there's also quite a bit of information on active offer. So if you are a French-speaking staff within an organization, it's not just about acting as an interpreter, but also how to implement or use your French language skills to improve the experience of the patient or client. We also have several examples of documents to support identification and designation criteria, which basically means we have developed a lot of resources internally that are all available on our website to help you to build your French language service capacity if you're a provider. And we've recently developed a lot of one-pager documents, which is how we refer to them, to just make it easy for the provider. We have one-pagers on active offer, on the importance of identifying language with the patient. We did one specific around COVID-19 on what elements of French language service planning are important when planning those types of services. Those are just examples, but we'd be more than happy to share those with you if you have any questions at the end. And we've also developed an active offer toolkit, and our website has a section that is for providers that has pretty much everything there that we've listed today. So I'd invite you to go and have a look. Next slide, please. And this is the slide I was referring to in terms of the interactive online training of active offer. These are the 6 modules. So this is the appearance that it would look like. You sign up and then you take it at your own pace. It's approximately a 5-hour long training. And the first module is excellence in patient-centered care. Second one is equity and security. The third is cultural competency. The fourth is recruitment and retention of bilingual human resources, work environment and organizational culture, and community engagement. Next slide, please. And other French language health service resources are the French language training reimbursement program. Depending on the level of French that you're at, it's intermediate and above, you can apply for this French language reimbursement program. Angèle Brunel Brunel from L'Accueil Francophone can probably answer more to that. It is managed through her organization. And we invite any questions again at the end. The translation program, so any provider that I mentioned earlier that is identified has access to free translation of materials, patient forms, anything that is directed or for patients or clients can be translated through the service if you're an identified provider. The interpretation services and guide and MedInterpret app I'll go through in the next slide when discussing L'Accueil Francophone services. The CNFS internship program is a program that allows French-speaking students that we help try to encourage placements of these French-speaking students in our regions. And there's also the Health Human Resources strategy, which offers a lot of information and support on French-speaking health, human resources, recruitment, retention, everything. Next slide, please. So in this section of my presentation, I wanted to specifically introduce Angèle Brunel, who's Executive Director of L'Accueil Francophone de Thunder Bay, and talk about their French language interpretation services. Many of you have already used L'Accueil Francophone and their interpreters. I see that today we have 2 interpreters and Angèle that are present during this lunch and learn session. Next slide, please. I will present the information for Angèle, but she is available at the end for the questions. So the interpretations, L'Accueil Francophone is funded through Ontario Health, through the Ministry of Health, and they offer in-person interpretation services for Francophones attending healthcare appointments in Thunder Bay. And they, most recently in the last few years, they have been able to purchase telemedicine equipment, and they also offer interpretation for Francophones attending healthcare appointments in the Northwest or Algoma region. The client or patient can contact L'Accueil Francophone. Their website is there, and their phone number and everything is on the website, and they can book an interpreter themselves, or the health service provider can contact L'Accueil Francophone and book it for the professional and for the client. The next slide, please. The interpretation guide, which we mentioned earlier, is a really good tool that L'Accueil Francophone was able to develop a few years ago. And it's available in a booklet in English and French, and goes through a variety of different clinical settings. It's not meant to replace an interpreter or act as a sole tool, but it's really a good support tool for any health professional. And following sharing of this tool, it was brought to L'Accueil Francophone's attention that, you know, this would be a fantastic electronic app or a mobile app. And actually there was funding available, and now it is an app, and you can download it for at no cost on your smartphone, whether it's through Google app or through your Apple store. And it's called MedInterpret. So again, it'll give you the verbal sentence of what you're looking for in French, and the written sentence of what you're looking for. And then with the app, there is a play section so that it's read to you as well in French and English. Next slide, please. And I'd like to end the presentation today with this slide that means a lot to me. It's the difference between equality and equity. We know that when it comes to French language services, we truly need to bring an equity lens. Sometimes it's about the population being small or the resources being limited. But I think if together we can be creative and work together, we can make sure that people get the resources they need. And I have the second video. I see that we have 20 minutes left. So what I'd like to do now is encourage any questions and offer Angèle the opportunity to add anything about the interpretation services of L'Accueil Francophone. And at the end, if we have some time, we could play the second video before we end off. Turn it back to you, Stephanie.
Thank you very much for the presentation, Chantal. So we did have a couple questions coming in, and I see Sherry has come off. She's put her video on. Did you want to ask your questions live, Sherry?
Sure, that's fine. Thank you, Chantal. I was wondering, I work for Hospice Northwest, and we are actually just in the process, starting very soon, of recruiting some volunteers. And I'm wondering, from your expert guidance, if you could let us know where the best place or how we could best recruit some French language volunteers.
I think the best place to start would be with myself, and I have access to different leaders in the community, and I would be more than happy to formally share your request. And we have a Carrefour Santé, which are basically Francophone hubs where we do our regular community engagement, and I could share it with those members and be more than happy to help you with that. And Angèle also is a good person to share that with, and we would work together to help you.
Okay, that would be great, thanks. And then I also had a second question, and that is how to get that active offer toolkit. And if you told us that, I missed it.
It's on our website. If you go under, I could send you the specific link after the presentation. But
sure, I'll put my email in the chat box. Thank you very much.
You're welcome.
Thanks, Sherry. Not seeing any other questions in the chat box. There was a comment about how incredibly powerful the patient story was. So thank you very much for sharing that. And I didn't stop it, so if it cut off early, I'm not sure, I apologize. Did anyone else have any questions? You can feel free to come off mute and questions or comments.
I have one other question. It's Sherry Koch again. I'm just curious to know in Thunder Bay or in our region, what do you know of a percentage of folks that are Francophone? Population?
Yeah, the population for Thunder Bay is just about 2.9. For the whole Northwest, it's about 3.1. However, like I mentioned in the population slide, the District of Thunder Bay has a larger population, the 12.3, I believe, and they tend to access a lot of services in Thunder Bay, so it definitely impacts the services needed.
I just want to say hi and thank you very much for your very exhaustive presentation. Very, very helpful. I've been a volunteer for Hospice Northwest for about a year now, and I'm Francophone in origin, and a retired psychiatric professional. And what I'm wondering is, you talk of percentage. What is actually the number of Francophone speaking people in Thunder Bay?
I think, I don't have the actual, I can provide you with the exact number. I didn't include all the slides, but I'd be more than happy to include it in this presentation, and because we can modify it before Stephanie sends it out.
That would be helpful. And a question for Angèle is as well, how active and how much is l'accueil francophone, how to say it, how busy or how sought is the service by Francophones?
Hi. Last year we had over 14,000 services provided. Yeah. That's a variety of interpretation and support also. Yeah. So we have 3 full-time interpreters, and we are very busy, but always there's always room for to help service Francophone in all the capacity.
So are you saying you're kind of recruiting volunteers as well?
No, we don't provide volunteer.
Yeah.
At l'accueil, it's all staff.
Okay.
But we do, we have connection to different, let's say somebody looks for a volunteer in a certain area. We have, we know a lot of people, we have a lot of connections, so we can help you find volunteers maybe.
Okay, thank you.
You're welcome.
Thank you for that, Carol. And we had another question on the chat box from Carlina Chantal, and she asks, would you be able to recommend written resources in French regarding dementia?
I could certainly send, would it be something I sent to you, Stephanie?
Yeah, that would be perfect. I actually work with Carlina, so
okay, wonderful.
Pass that along to her. And I know we're looking at collaborating on a project where we're looking at trying to inventory resources around palliative care that are available in French. So it'll be great to get that started as well.
That is, and I think that was one of the activities that came out of the engagement that we did specifically with palliative care in the Francophone community in June to start creating a list of French language resources around palliative care. So
right,
we could certainly help with that.
Perfect.
Hello, can you hear me?
Yes, we can.
Hi, this is Athena. I am a nurse up in Sioux Lookout, and I understand that we are in a different, I think I'm part of the district of Kenora actually, looking at the coverage. So I'm not completely certain, like, are these resources available for me as a healthcare provider, like in a different region of Northwestern Ontario? Just because, like, we actually have some Indigenous communities that have members who speak fluent French as well. So on the shifts when we don't have, for example, like a Cree speaking interpreter, I've actually been able to get around it by speaking my basic French. And so it would be, I think it actually does also open up access to some Indigenous communities as well. But I haven't heard anything from like Ignis, for example, which is, I think, this is our center for coordinating these things. So that was just my question for access of resource.
You can definitely access all of these resources. The only thing without the French language translation, if you're not from an identified agencies, those are not available. But all the resources we offer, the interactive online training, l'accueil francophones, even interpretation by telemedicine, those are all things that you have access to. So yeah, and as far as Ignace, they are a designated township community, and I have done a lot of work there with the Mary Berglund Community Health Center. I've done specific community engagement there for several years. Actually, 2 years ago now, we had a Francophone Seniors Fair in partnership with Dryden and Ignace, and we tried to do to make sure that they're involved in any engagement we do. We've had NAWSOM come out there and do an engagement with Ignace as well, and Dryden. So yes, but if you want to access the resources on our website, you feel free to do so.
That's great news. Thank you so much. Merci.
Well, thanks everyone for your questions and comments. We still have about 10 minutes left. Do we have any more questions? Well, it looks like we might have time to go back to our last video, Chantal.
Oh, that's wonderful. Well, thank you very much, Stephanie, and thank you everyone for participating today. And I would be more than happy to receive emails from you and share anything else that you need in the future.
Well, I'd like to thank you as well, Chantal, on behalf of the Center for Education and Research on Aging and Health. So we'll play the video and close out from here. And I just want to say, yes, thank you for reminding us all the importance of having French language services available. Definitely makes sense that quality palliative care would certainly include culturally adapted care. So I really appreciate the presentation and the sharing of the tools and the resources that you've been able to provide, and also your willingness to, of course, engage with organizations to help them move this forward. So thank you very much. And I can cue up the video. Did you want to set it up at all before I play it?
No, that's okay. You, well, I'll actually introduce it. You mean, yes.
Sorry.
Joanne, this is our newest video in our resource bank, I guess you would call it. It's on specifically on palliative care, and Joanne lived through some difficult times while accompanying her mother and her brother, both in palliative care in the same year. Very sad. Despite the compassion and good care from the staff, she would have wished for her loved ones to live their final moments of life in their mother tongue.
Mon frère est rentré à la maison de soins de longue durée à la fin du mois de novembre 2015. Ma mère au mois de décembre 2015. Un peu comme ça, ma mère est décédée en juillet 2018 et mon frère en octobre 2018. Du moment où on a déclaré ma mère palliative, moi j'ai déménagé dans la chambre. Les gens ils ont été hyper sympathiques, hyper aidants. Vérifiaient toujours sur la famille. Mais la chose qu'ils ne pouvaient pas nous donner, c'était un service en français. Ma mère, jusqu'à son décès, c'est nous qui faisions de la traduction parce qu'on ne savait pas à quel niveau elle comprenait. Donc, malgré le soin exceptionnel, c'était un soin en anglais. Puis à ce moment-là, c'était pas... Ma mère avait besoin d'un soin en français, mais la famille avait besoin d'un soin en français. Puis peu importe la compassion qu'il y avait, c'était en anglais. Puis même là, ma mère était mourante. Moi, la priorité, c'était ma mère. Ce n'était pas faire de la traduction, de transiger avec des gens dans une langue qui m'est moins familiale. Mon anglais est fort. J'ai pas de difficulté. Je suis encore assez jeune. J'ai pas commencé à perdre l'habilité de parler les deux langues. Mais quand même, c'était une situation que moi, j'aurais préféré vivre en français. Mais j'ai pas eu l'option de vivre en français. Je l'ai vécu en anglais. Mon frère, c'était encore plus important que ça soit en français parce que lui, quand on le laissait seul, pour ma mère, on quittait la chambre. Puis là, les infirmières les préposaient aux soins, nettoyaient, prenaient soin. Mais avec mon frère, on ne pouvait pas faire ça parce qu'il devenait très agité, même s'il n'était pas conscient du tout. Il n'y avait aucune réaction, il devenait agité. Là, ses jambes, ses bras commençaient à grouiller. Il voyait une agitation par respect, puis pour sa propre sécurité, c'était important qu'il reste calme. Donc, on me demandait de rester dans la chambre. Puis la seule façon qu'on le gardait calme, c'est je lui parlais très calmement en français. Je lui expliquais ce qu'on y faisait. Si j'avais pas été là, tous les résidents qui se trouvent dans cette situation-là ou qui n'ont pas la famille de près, ils font quoi, ces gens-là? Je suis très choyée d'avoir été avec ma mère et mon frère jusqu'à la dernière minute. Les deux sont décédés. Moi, je leur tenais la main. Je les ai accompagnés jusqu'à la fin. Il y a des familles qui n'ont pas ça, mais s'ils ne peuvent même pas mourir dans la langue de leur choix. On est un pays bilingue, mais ta naissance, ton décès, tes maladies, ça, il va falloir que tu vives ça en anglais. Il me semble que c'est un non-sens. Ma mère et mon frère ont été choyés parce que la famille les a entourés tout le long. Mais c'est une expérience que j'aurais préféré vivre en français. C'est aucunement une façon de mépriser la communauté anglophone. C'est simplement, moi personnellement, je pense que c'est une question de sensibilisation. Puis là, ça fait 50 ans que la loi sur les langues officielles existe. Ça fait 50 ans qu'on se dit un pays bilingue. Mais semble c'est le temps qu'on fasse de quoi, plutôt que de juste en parler. Nos parents, nos ancêtres, nos aînés, ils ont travaillé, ils ont contribué. Il me semble qu'on leur doit le respect. Leurs dernières années soient faites dans la langue de leur choix, de la langue où ils se font comprendre. C'est injuste qu'ils ressentent être étrangers chez eux.
Another very powerful video. Thank you for playing that, Stephanie.
It's very, very powerful. Thank you once again, Chantal. Before everyone runs away, I was just going to launch a quick poll that we do to evaluate our sessions. If people can answer a quick 3 questions for us before you head out. And thank you once again for joining us today. And we will be sending out information about our February session in the near future. You should have the poll up on your screen now.